We had the opportunity to film at Southern Central Ambulance Service at their sim suite in Newbury. Simbulance is their simulated ambulance and is a great example showing how simulation-based education can be used in other scenarios outside of secondary care. This scenario relates to a national initiative around patient safety, and in this scenario it's an opportunity for trainee paramedics and midwives to work together in a high impact situation.
This centre at Newbury is one of 3 education centres. This one has a complete focus on simulation and driving education. We've developed a course called the PHONE course. PHONE course stands for Pre-Hospital Obstetrics and Neonatal Emergencies, so we call it PHONE 999, and it's a collaboration or partnership between the Royal Berkshire NHS Foundation Trust midwives and the South Central Ambulance Service Education team. We've been able to employ 2 midwives for a couple of days a month in order to help deliver our obstetric training here. This course predominantly is to provide emergency obstetrics and maternity training for those paramedics and midwives that work in our community settings, whether it be their houses or homes or actually out in the field, such as between hospital and car. So garage forecourt is not an uncommon place to deliver a baby. This course is particularly designed to improve human factors amongst midwives and ambulance service and other professionals, including the bystanders and family members. We also teach people about how we manage a patient, both in terms of their airway, their breathing, their circulation levels during emergency childbirth. We then go on to teach in scenarios form a number of different activities, from normal childbirth to shoulder dystocia.
We've done situations where the patients had a breech birth or cord prolapse, where the mothers had sort of eclamptic seizures, and we've had to work alongside the midwives to treat those patients. So I'm in my 3rd year of training, and this simulation really helps us during this year to really help give us the confidence that we need to go out and treat these patients on our own in their home environments. We've worked with midwives that we wouldn't come across day to day, and we've worked with other paramedics from other services, so they're trained in different places and trained in different ways. So to come together and work as a whole, it's a good team environment.
I feel like I've learnt loads. So I qualified nearly 6 years ago, and I had some maternity training but not a lot, so I do really feel like my knowledge has been increased. I think the paramedics in particular, I think we've really enjoyed just picking ideas and sort of from the midwives and talking to them and sort of picking their brains at every opportunity that we've had, and vice versa as well. I think sometimes it's one of those jobs that don't come around very often, but when they do, you need to sort of be on the ball and know what you're doing. So I feel like having this refresher course and actually learning new things has been really beneficial.
At the start they get asked how their confidence level is with dealing with pre-hospital maternity cases, and often we find that paramedics are worried about dealing with community births. You've got both mum and baby to think of. A couple of people have actually written into the education team and the Royal Berks just to say actually their training that they received today was invaluable when they were faced with a community maternity emergency. And that's really good news. That confidence that we're trying to get across is actually achieved. We find that with the simulation, both high fidelity and low fidelity simulation, that enhances our learners' experience. South Central Ambulance Service was able to design and deliver the first simulation ambulance, which we call Simbulance in the country. And we use that vehicle to deliver real-time and authentic simulation, both here in the training centre, but also it can be driven to ambulance stations and to birthing units or maternity units. So we use other technologies alongside the Simbulance, such as the iSimulate, which provides us with a simulation platform that the clinician can connect and actually see what's happening with the patient, but we're in full control of the blood pressure. I think the use of technologies to improve learning is absolutely paramount. We see the learners, the millennials, using mobile phones on such a regular basis now. They want to see bite-sized pieces of learning on video and via pod or podcasts. They want to use technologies to refresh and repeat pieces of learning that they may have done in the past. And our ultimate aim is to improve patient experience and patient safety.